Welcome everyone to our Faculty Senate meeting for February 22nd. Want to thank all of our guests who are here with us today. We have our agenda posted. Colleagues, given the number of individuals who are visiting with us for a particular purpose, I'd ask for unanimous consent to suspend the orders of the day with the idea of moving item number 8 forward on our agenda so that it would become our first agenda item. Of course, ask the provost and presidents if they are okay with that as well.
I wholeheartedly support that, Finney. Thank you.
Finney, this is Christine.
President Stokes?
I would vote that we make the changes as you suggested, or move.
Thank you very much. Out of courtesy, President Stokes, does that comport with your schedule?
Yes, it took me a moment to find the agenda, but yes, absolutely.
Thank you. Colleagues, I ask unanimous consent to move agenda item 8 to the top of our agenda. Is there any discussion? Hearing none, we will move to our first agenda item of the day, which is the A88 for Africana Studies. This is an action items, colleague that we'll be voting on. I ask consent from the body to address the body. Is there any dissent on that request? Hearing none, colleagues, I'm honored to co-present A88 for the approval of Africana Studies, its transition from an academic program to an academic department. I'm joined by Dr. Kirsten Buick, who is going to actually present the A88 to the body. When I arrived at UNM in 2005, I came here to direct Africana Studies. And at the time, it had the largest faculty of the ethnic studies programs and actually offered a major. And over the years, we've worked to bring this program to where it stands on the precipice of becoming today. And I would be remiss if I didn't thank a lot of people who aren't on the screen today. The previous directors, those who mentored me when I first came to that position, the folk who have served in that position since I left as director to go on to University College, and a great deal of thanks to Dr. Buick in particular, who has worked steadfastly to make this a possibility. Dr. Asada Zarai, who's worked very hard, Dr. Nancy Lopez, all the members of the committee who, won't name them all. I see my colleague, Dr. Jamal Martin, all of us who collectively have worked so hard to make this a reality. With that said, I could go on quite a long time about why I believe we as a body should vote for this, but as the head of the body, I will not be voting. But I'm happy as president of the Faculty Senate to be able to hold the vote. I would like to open the floor for comments from our guests regarding this process. Please limit your comments, if you don't mind, to just a minute or so. I'd ask that Dr. Zarai, I hate to put you on the spot, Dr. Zarai, but that if you would go last at those comments, and then I'll turn the floor over to Dr. Kirsten Buick to present the A88 to the Faculty Senate. If you have questions or comments, please raise your hand and I will acknowledge you. Provost Holloway.
Thank you, Finney, and thank you to the assembled Faculty Senate, and also for the assembled guests who've done so much, not just over the last year or so, but really for years before that to bring this to this point. I certainly wholeheartedly support this move. It's been something on my radar since I came here in 2019, and I'm just thrilled to see that we've reached this point, and look forward to seeing a immensely successful Africana Studies department at UNM. Thank you.
Thank you, Provost Holloway. Any comments, thoughts from our guests? Seeing none, Dr. Zerai. I'm sorry, Dr. Lopez.
Yes, thank you.
Saludos familia, greetings family. I'm thrilled that we're here at this moment. I remember starting with Dr. Kirsten Buick over 20 years ago as an assistant professor and hoping that this day would come, and I'm thrilled to be here. I'm Nancy Lopez, professor of sociology, also director of the Institute for the Study of Race and Social Justice and associate VP for Equity and Inclusion. This is going to make a difference not only for our students, but also for faculty who need an intellectual home to do this kind of inquiry, teaching, research, and community engagement. Thank you so much for inviting.
It's a pleasure to be here today. And I just wanted to say that it's very fitting that we are considering this during Black History Month. And I do want to thank our dear Professor and Associate Dean, Dr. Kirsten Buick, for her work to help bring us to this moment. And thanks to President Stokes and Provost Holloway for their support. And I would be remiss if we didn't call out the names of some of the tireless leaders, Dr. Becknell, Jefferson, Coleman, Professor Emerita Sherry Burr, Dean Emeritus Mathewson, among with others whose tireless dedications really joined that of Dr. Buick today. And we believe will result in an illustrious future for Africana Studies.
Thank you, Dr. Zerai. Colleagues, I'd like to introduce Dr. Kirsten Buick to present our A88. When I was Director of Africana Studies, Dr. Buick graciously agreed to serve as the Associate Director. And Kirsten, on a very personal note, it has been a true pleasure working with you for all these years. You are one of the true lights of our university, and I'm so proud and happy for everything that you've accomplished, and wish you the very best as the inaugural chair of Africana Studies, assuming, of course, this body agrees that we should make the move to approve the A88. Dr. Buick?
Thank you to the members of the Faculty Senate and to the guests today, this afternoon. I've been at UNM for over 20 years. I average mentoring 30 students per semester, and UNM has fulfilled me. In the early days, I used to look at it like it was a country made up of different states. And being in the College of Fine Arts, I wasn't in a very good state. But I have grown to look at it as a house with many rooms. And I will bring to Africana Studies everything that I brought to my college and to my department. I'm committed to UNM. I am committed to our students. I am committed to excellence. And so with that, I present to you the A88.
Colleagues, we have an action item on our agenda, an A88 for the transition of Africana Studies from an academic program to an academic department. Is there any discussion? I assume the body's ready for the question. Rick, can we post the poll, please?
Okay, it was approved 40 to 43 with 3 abstentions.
Thank you, colleagues. That motion passes. Congratulations, Dr. Buick. Colleagues, the next item on our agenda is report. The approval of our agenda, which I should have done before. I'm sorry that I went out of order there. Are there any changes? Hearing none, the agenda is approved. Colleagues, the next item on our agenda is approval of the January 25th, 22 meeting minutes. Are there any changes? Hearing none, the minutes are approved. The fourth item on our agenda is the report from President Stokes. President Stokes?
Good afternoon, everyone. What a great day. I'm so happy to see the vote, the successful vote. So I want to try to keep this brief. I didn't have an opportunity to confer with our provost to see, how much am I going to cover and how much is he going to cover? So, hopefully I won't take too much from his presentation. I know that at the last Senate meeting, which I unfortunately had to miss, so sorry not to see you. It's been quite some time since I've been in front of all of you. But I know that James reported out on our 2040 Opportunity Defined Plan. And I've been making several presentations about that plan, presented it to the regents, I think last week, also to the foundation board. I present to the alumni this week. We are continuing to tweak the plan, and what I would hope is that we'll have additional information perhaps that I can present to you when we next meet at the next Senate meeting. I hope some of you were able to get on our creative, innovative platform, Idea Scale, and offer some thoughts. I know we're using all that information to help guide us as we move this plan forward. It's been quite a process that started at least 10 months ago officially. So, of course, the last few weeks, we've been kind of immersed in the legislative session. Those of you who've been around for a while know that alternative years, we have a 30 versus a 60-day session. This year was 30 days, and it was quite a crazy time. If you read the news, then you saw just how hectic it can be to get through a 30-day legislative session, although 60-day legislative sessions are pretty hectic as well. We went into this session with a number of legislative priorities. They won't be of any surprise to you. Our biggest priorities are almost always, along with the council of presidents for the other four-year schools, compensation looms very large, and increasing the amount of instructional and general funding that we get, the ING that we get from the state. So in this particular session, it appears we will be getting the ING portion of a 7% compensation increase. Those of you who've been around for a while know that the formula that funds the ING portion and doesn't really cover the cost for all employees. So that's something that we will be looking at, and we'll have more information as we get through the rest of the session, while we wait to see what the governor actually does. And her deadline to make vetoes will be March 9th. What I understand though is that we're going to get funding for an across the board 3% for the fourth quarter of the current fiscal year, and then funding toward a full 7%, an average of 7% beginning the 1st of July. So lots of details to figure out there, but I did want to be sure you're aware of a little bit of what this is looking like. It appears we also will could receive an increase to our instructional and general budget of 3%. 1% of that is held by the higher education department as they await an enrollment plan. And we don't yet have the instructions for what that enrollment plan needs to look like, but that is something that the legislature has been very concerned about, and they want to be sure that every institution, higher education institution in the state, is actually working on building their enrollment. And so we'll be developing that plan so that we can realize the full 3% of that increase to our ING. I think many of you are aware that we have a big process for actually bringing forth research and public service projects. A lot of our special, really important programs at UNM are funded via this process. And so it appears that we do have many RPSBs that have requested and received some expansion of funding. A lot of those are tied to our student services, but we also have others that are tied to things like Project ECHO, the Office of the Medical Investigator, an HPV registry. It looks like we have some additional funding that we hope to receive, that it'll all stay in the budget, related to an endowment for Native American faculty. There's some support for athletics, support for nursing expansion, support for some things related to our nursing building. We also had our GO bonds. Many of you are aware that every other year we bring forward major capital projects that if they get through the legislature are then sent to the voters to support. And so our general obligation bonds this year, we have received approval for the $45 million for our Center for Collaborative Arts and Technology, and $36 million for the Children's Psychiatric Center. These were our two big projects for the GO bonds. So assuming all of this gets through, we'll be doing a big push to hopefully get voter support. This is a big proportion of the total bond capacity for the state. So University of New Mexico hasn't done quite this well in a while in terms of the proportion of total dollars. But it reflects a reality that we're a huge institution proportionally in the state with big needs for capital projects. And so really optimistic about what this could look like. Those who've been around for a little while as well probably know a little bit about the fact that sometimes there's something called a junior bill. I understand that the junior bill is popular in some quarters and unpopular in others, but it is a mechanism by which we are able to try to get additional support for a variety of programs. And there was a junior bill again this year. It looks like we may have doubled our allocations from the previous year, about 3.7 million. Now, these are all subject to potential line item vetoes. So once we get through all of this, we'll be able to give you much more detail about what we actually did get through this legislative session. Another very big issue for this session, which the presidents of universities were called on to speak to during this session, had to do with the Opportunity Scholarship. It's a big agenda item for the governor. It was labeled free college. The Opportunity Scholarship really started, in the governor's first year, but this was an expansion of the thinking about who it would apply to. Our students have been really focused on the lottery scholarship, and UNM students have benefited greatly from the lottery scholarship. But it turns out with its applicability to four-year institutions, our students also benefit from the Opportunity Scholarship as well. So it provides funding for our students to cover tuition and fees, and can be a great benefit in allowing students to continue to stay in college and complete their degrees. So lots of details to be worked out on these things. But I think you'll find that our students will be very pleased with this level of financial support for their higher education in the state. And then we'll see where all of it goes in the years to come. Lottery is it looks like funded for at least the next 3 or 4 years. And so I think we've got some stable funding there that was really important to our students and to us as the leaders. You might have heard a little bit about a School of Public Health. This was one of those things that will come up during a legislative session. We have been talking quite a bit about having our College of Population Health become an accredited School of Public Health. And so there were a couple of champions in the legislature that really felt like in a year when there was so much money, with COVID pointing out the incredible needs for public health in the state of New Mexico and elsewhere, that it was a time to look for that. And it does appear that we may receive $10 million at UNM toward building out the support for faculty and staff and operations to actually be able to become an accredited School of Public Health. So there'll be a lot more of that to come. I'm putting together an executive committee to look at, the development of this school. What was also proposed had been a building. That funding really hasn't come through, but that gives us an opportunity to really think about what a School of Public Health will need for the institution going forward. I see this as truly a cross-campus collaboration, because public health is something that many disciplines at the university contribute to. And so it is part of that goal of one university, and a big opportunity for many in the state and at UNM. Speaking of government relations, I am launching a search for a chief government relations officer. Many of you know that Barbara Dameron served in that role. Nathan Bush has been a wonderful interim leader, but we are launching that search. So there'll be more information about that forthcoming. I like to give a lot of good news when I speak to any group, but I saved it all. Well, I gave you some good news related to funding, but in terms of celebrating the successes of our faculty, our staff and students, celebrating the success of our programs, I've largely saved it for the State of the University address, which is scheduled for delivery on Thursday at noon. And then it'll be available for anyone to watch. And so I hope that you will tune in. There's a lot of great information about what has been accomplished at UNM over the last 12, 13 months or so, and some real things to be proud of. So I hope that you'll get a chance to look at that. I do want to acknowledge that the governor ripped off her mask at a press conference on Thursday after the legislative session ended, and that was unexpected. And so we are carefully reviewing what this looks like for the university. We're hearing from a lot of people. We are examining our local data, conferring with our health experts, our health protocols committee. We are expecting guidance from the CDC. And so I just wanted you to know that we will carefully review all of this, but for the time being, and this was in my President's Weekly Perspective yesterday, the mask requirements that we've had in place will continue to be in place. We will give plenty of warning about any changes to this, but right now, all we're doing is gathering information from people and collecting more data. So just wanted to be sure that I acknowledge that. And Finney, I'm not sure if you'd like to do what we've done before, which is allow the provost to make his presentation and then open it up for questions, however you want to do it.
I think that would be good. folk don't mind. Provost Holloway?
Well, thank you, Finney, and thanks again to everyone. At some level, I'll be actually very brief. I'm just going to provide a gloss on a number of President Stokes' comments. I would like to once again say congratulations to all of those who worked so hard to create a Department of Africana Studies, and congratulations to Kirsten Buick for taking on the leadership role that is going to usher this department into the next phase of its history. So thank you. So just a few glosses really on some of the things that President Stokes said. One thing I wanted to do is kind of put some numbers on the comments about the 7% compensation increase that is currently being presented to the governor in House Bill 2. Just so folks have a kind of a sense of what it means to do the compensation increase at 7% for the part of the university that we've traditionally called main campus, which is basically facilities and finance, the president's organizations, but the bulk of it is really all of the academic affairs units. It's about $16 million. The state will provide about 11.3 million of that. The difference we have to find as tuition revenue. Well, there's not many places it comes from. So that just gives you a sense of the formula that the state uses to fund these compensation increases. Covers about 70% for the ING portion, and then for a number of other units actually doesn't cover any of it. So that's where we're looking, and I've given budget presentations to this group before, so you've got a sense of kind of where we are. The next item I kind of wanted to put a bit of a gloss on was enrollment. And so in House Bill 2, there is this requirement that we provide an enrollment plan to HED, which they're currently putting together the kind of their requirements around that. We're not super worried about having to provide an enrollment plan. We have a strategic enrollment plan. We've had it for the last couple of years. We actually presented it to HED last September. So we'll be simply updating that and providing that as well. And so that comes out of Dan Garcia's shop. So we think we're in good position on that. And on enrollment then, as we look towards fall term, which is our fall enrollments are kind of key drivers for how many students are we reaching, how many students are we teaching, how many, to what extent are we delivering on our mission. We're in an interesting place. It's not an unexpected place. Total applications are down for the fall, but admits are up. And so for at this point in time compared to last year, we have admitted more students, about 16% more than we had at this point in time last year. How can applications be down and admits up? We have far fewer incomplete applications than we have historically had. So part of the work that Dan and his team have done is to make sure that one, students complete applications, two, that we don't encourage applications that aren't viable, which has happened in the past sometimes. So we've gone from last year, we had about 24% of our applications were incomplete. This year, it's about 9% of our applications were incomplete. So we have far more complete applications, even though the total number of applications is somewhat less. The other thing we're doing is admitting students much more quickly. And so the enrollment management team reviewing applications really quickly so students get a notice, hey, you're a LOBO. That's really important because it's very well known in student behavior that the sooner you're admitted, the more likely you are to go to that university. There's a lot of research and study about that. I will say that when my own son went to college, I experienced it firsthand. The first university that admitted him the second university that admitted him had him. The first was the safety school, but the second one had him. And then when later schools admitted him, it was too late. So making sure that we have good applications and that we admit quickly are some really critical tools for us that lead to an increase in undergraduate admissions so far. We're also seeing a big increase in international student applications. that's terrific, right? And it's a reflection of moving out of COVID and changes in immigration processes that make it more attractive for international students to come to UNM. So we have over 400 international applications this year at this point in time, compared to about 170 last year. And transfer applications were about flat. No big changes there. I think the big areas for concern are really at the graduate level. So we're seeing master's applications down about 30%, but admitted students are up by 10%. So some of that same dynamic playing out there. So not a huge worry, and it's early in the graduate application cycle. The other area, though, that's at least a flag is doctoral applications, where applications are down a little bit, about 5%, but admitted students are down by almost 30%. Now, again, it's early in the cycle. We shouldn't overread that, but it's something for all of us to just kind of be aware of as we work with our departments and look at admissions for doctoral students to make sure we're getting the students who we want admitted, because they also will tend to go to the school that admits early. So again, I think we've had huge increases in new graduate students the last 2 years, about 19% and 20% each of the last 2 years. We'd sure like to see that again. So that's one area we're paying some attention to. And then the last kind of piece of update, a gloss I'll add is around masks. We continue to distribute ASTM level 3 masks across campus. That's kind of the kind of mask that's required. We've distributed about 53,000 of them in the last month, and we're continuing to do so. So those are available in central classroom buildings. They're available in the sub. They're available in Zimmerman, Johnson, number of central locations. We've also shipped a number of masks out to the branch campuses as well. And at the end of last week, we started distributing KN95 masks for instructors, all instructors, faculty, and graduate student instructors. First tranche of those 10,000 or so went out last Friday. We just shipped off a bunch to the branches, and we have another tranche of those masks that we're distributing around here in Albuquerque as well. So just be aware, let your colleagues know if they're looking for a KN95 mask to do their teaching in. They should check in with their departmental offices, because we've pushed quite a few thousand of those out into the system. So hopefully those will be helpful to folks. And I'll stop there, and the president and I can stand for questions.
Thank you. Any questions for President Stokes or Provost Holloway colleagues? Larissa?
Hi, thanks for calling on me, Finney. I have a couple of mentees who are graduate students in public health, or right now it's population health, sorry. And they are concerned about not having enough information about students and faculty in their classrooms that may be affected by COVID, and not being notified that they have potentially been in the vicinity of students who are COVID positive. And they voiced to me, because they know I'm a faculty senator, concern about, one, that their voices aren't being heard about requests for remote teaching, and two, or remote learning, and two, that they're not being notified, not even in a timely fashion at all, really, that there was, classroom exposure, in a class. So I wondered if we can speak to that issue, or how I can answer those questions for them.
Sure. Thanks, Larissa. And then if I'll jump in, and if President Stokes wants to follow up, she can as well. So with respect to teaching modalities, we really do ask that instructors work with department chairs to figure out what is the right set of teaching modalities for any particular group of students. One of the things we should really be looking at is student success. And we have data from, and you can find this on the Office of Institutional Analytics website. We put it up there now. Data showing that, for example, lower division students in asynchronous classes that were not designed as AOPs have very large drop, fail, withdrawal rates compared to, say, face-to-face classes. So one of the, and that data is incredibly complicated, by the way. Different course modalities, different kinds of students perform differently in those different environments. The way graduate students perform in a kind of an ad hoc asynchronous course is very different from the way upper division students perform, the way lower division students perform. AOP classes that were purposefully designed as asynchronous and provide a set of supports, very different performance than kind of ad hoc asynchronous online. So it's a lot of different cases, but the bottom line is that different students perform very differently in different course modalities. There tends to be a correlation with student experience, student maturity, if you will, educational maturity in how they perform. So we really do have to be very mindful about course modalities. And we also need to be, for student success, we also need to be mindful about course modalities as far as making changes in the middle of term, because students signed up for one thing and then they're suddenly getting something else. So for all of those reasons, we ask instructors to work very closely with department chairs on what is the right set of course modalities for their curriculum. Because it's also not about a single course, it's about the whole curriculum and the whole experience that students are having. With respect to contact tracing and notification, I have to say that I'm not sure where the formal contact tracing for UNM has been done by the Department of Health for some time now. I'm not actually sure where they're going given the changes that the governor started making to various health orders. So where they were very aggressive, and I haven't looked in a while. They used to publish time between contact and informing those who were potentially exposed. Those times used to be posted. I don't even know that they post them anymore. So I have to say I'm not sure where that effort is going from a state perspective either. I think, let me say that I don't know that those answers are helpful. I do think that we've heard the concerns expressed, that folks would like to know a lot of things about what's going on in their classrooms. I don't know that there's a space between hearing it and knowing how to best address that. But we have heard those concerns expressed, and do continue to give thought to, are there ways to try and address those concerns?
Subal?
Thank you.
Thank you, Finney. I have a question for President Garnet Stokes. I didn't quite catch the timing of the 3% and the 4% when you were explaining that. Could you please clarify that?
So my understanding is that the legislature, what has been designated is a 3% across the board tranche of funding. That's effectively, 3% on the ING for the fourth quarter of the current fiscal year. And so I don't really know what that looks like in terms of when we get it and how we distribute it. So we're awaiting information about that. We're actually gathering information, but we have more to gather. So 3% in the final quarter of this year, so between April and the end of June. Then the remaining funding to get the total compensation at an average of 7%, with the caveats that the provost already gave you. My understanding is that it would be available July 1st. So for the next fiscal year, that's what we know at this point.
Thank you.
And as always, none of it's real until the governor signs the bill.
I know. Lots of details here, so.
Any other questions, colleagues? I do have one question. I was, I think, as surprised as anyone else here that the governor removed her mask, and I immediately began thinking about what the implications would be for us here at UNM. And I know that we're going to carefully consider the science before we make any decisions, but I'm wondering about the time frame. How long will it take for us to make a decision one way or the other? Is that something that will take us weeks to decide, or is that something that will be done fairly quickly?
Well, we jumped on it immediately, I will say that, and we are starting to, have the conversations now. I would certainly hope that we would have something. I haven't really talked with the team about what our deadline is, but I'd really hope that we would say something about what we're doing next week. We are awaiting, something from the CDC. We were hoping we might get something from them this week. We don't know for sure how much that will clarify things for us. We're looking at numbers. My hope is that what we might be able to do is set some parameters around what would lead us to change this, our current practice. So, James, I don't know if you have another thought in mind about when we might, say something more other than we're gathering information and we will, keep this in place and until we are able to say we might do otherwise. We're trying to be sure that we, really confer with what's happening in health sciences as well. Of course, the hospital systems, they're all still required to wear masks. So we're really trying to deal with information both locally and then statewide. So James, did you have something?
Sure. So, I think first the last point's an important one to us. Increasingly, early on in the pandemic, we weren't always closely aligned with health system decisions, and increasingly we tried to have one set of policies across the institution to the extent that they make sense, right? Recognizing, of course, that the clinical delivery system will always have some special needs. So we do very much want to think about that. Doesn't mean we couldn't have different policies, but if we don't, we want to have a clear reason why we don't. There are a couple of critical things happening this week. So one is that our health protocols committee is meeting, and these are among others infectious disease experts, public health experts. So they're talking about this issue this week. We do hope to see the CDC guidance, although again, I'm not sure that it's going to answer the questions. We'd be interested to see if the CDC changes not only its mask guidance, but its higher ed guidance. So we may see that this week. And then Friday, we have a meeting of the IMT, which is a group that gathers Friday mornings to kind of look at where we are with respect to COVID activities that's led out of HSC. So we have both the health protocols meeting this week, the IMT this week. So I think this week is the week that we're letting experts look at this and weigh in. So I think, yeah, it's possible next week we'll have some decision of where we're going. I hope I don't go out on a limb with my boss sitting here, but I would say that whatever we do, we're not going to suddenly switch. So if we make a decision, to switch. We're going to make a decision that says, at a time in the future, we're going to make this change so that people actually have time to adjust rather than making a sudden, sudden switch.
James, that's entirely in line with the way I look at it.
I actually knew it was. So all that to say, Finney, that we might publicly announce a decision next week, but it would mean something like, at a date in the future, this thing will happen. And in the meantime, by the way, I just want to re-emphasize for everyone, we are wearing masks on campus. We're wearing them in indoor spaces. We're wearing them in classes. I encourage people to do that. We've got our mask ambassadors out handing out masks to people if they don't have masks. Nothing has changed as far as our policies go within our educational and research spaces. Sorry, Finney, I interrupted you.
No, I was simply going to ask. I can imagine a scenario where you might have a student come into a classroom and say, well, the governor has lifted the mask mandate, not understand our policies. What guidance are we giving to instructors to deal with situations like that? Hopefully none of those things would happen, but I can certainly see that as a potential scenario.
Sure, and nothing has changed as far as the enforcement mechanisms that are in place. And so if a student is unmasked in the classroom, they can be asked to mask. If they refuse to mask, they can be asked to leave. If that's a repeated behavior, we can enter them into the student discipline process. Over the last 2 years, we've had to do that a few times. Very few, I should say. I think for the most part, our students, when have worn their masks, and when they're not wearing their mask and they're told to wear their mask, they do. But in any event, the same enforcement mechanisms are in place that we've had up till now. We've sent those out to instructors at the start of term. They're also listed on Bringing Back the Pack, the website there. Just know that in the end, you can ask a student to leave your classroom if they are not in compliance with the appropriate masking policy.
Okay, thank you. Any other questions for President Stokes or Provost Holloway? Chris?
Hi, Provost Holloway. Forgive me for not turning my camera on, but my internet is terrible.
No worries.
One thing I'm curious about is, of course, individual faculty have individual contexts, individual health concerns, health needs, et cetera, et cetera. So one thing I'm wondering is how much independent or individual faculty decision-making will be allowed in an individual classroom. So for example, let's say UNM decides, based on everything the CDC has said and all of the various groups that you're meeting with, decide it's safe to remove masks in the classroom, but a faculty member doesn't feel comfortable doing so. So will they be allowed to ask their students to wear masks? I understand that if it's a campus rule, the students wouldn't necessarily be punished or anything like that. There wouldn't be anything punitive. But is there going to be any concern about faculty asking their students to wear masks so they feel safer, so their students feel safer?
So thanks for the question, Chris. And I can't give a definitive answer because we haven't rolled out what a new policy might be. I can tell you that we've discussed that exact scenario. So it is on our radar to think about whether that kind of latitude would be appropriate or not. And so once we get to the point of actually decide, if we decide that we're going to keep masks on for the rest of the term, it's a sort of a moot point. But we have indeed discussed exactly this question of what kind of latitude is appropriate in different kinds of spaces. So as we hear from our health experts and figure out what this policy is, that is something we're thinking about.
Thank you.
Any last questions? Hearing none. Thank you, President Stokes. Thank you, Provost Holloway. Appreciate your time as always.
Thank you all.
Thank
Take
you.
care.
Colleagues, the next item on our agenda is the President's Report. I have 4 or 5 items very quickly. Some of you know that Faculty Senate Handbook Policy C07 was essentially tabled at their last meeting, and then the meeting that would have taken place in January was canceled. The policy technically came back to the university secretary for disposition. Our outstanding university secretary and her team and my working with them went through all of the comments from University Council to CO7, revised that policy and provided a memo back to Regent Royale with having answered all of the concerns that we thought were practical from University Council. That's back in the hands of Regent Rael. It will be, of course, up to her. She controls the agenda for SSTAR, but we're assuming that CO7 will come to see SSTAR at the next meeting. As soon as I get confirmation of that, we'll make sure that we copy the Faculty Senate on that. There is some discussion about policy C100, but I don't have enough information yet to share with you all. But that policy might also be undergoing revision. But again, I'll share more when I know more. I'll know more about that next week. We are continuing the committee selection process. Please encourage your colleagues to fill out the preference form for committee service for next year. In the next few days, I'll go back to that database and start filling in our committee selections for the coming academic year. As you know, we have Faculty Senate elections. Make sure that in your colleges and your academic units that folk try to get those positions filled as quickly as possible, so that we can announce our Faculty Senate for next year, and also to begin our election process that will follow that. So again, hoping that we have a good set of candidates for this coming year. As I've mentioned to you before, I am term limited, so I will not be up this year myself, and just hope that we can have a robust slate of candidates going forward for Faculty Senate. If you're just curious about it, I'm happy to talk with anyone who might be interested in running for Faculty Senate President. I'd be happy to share everything that I know about it, so that you can make an informed decision about throwing your hat in the ring or not. The last item that I have is about our online meetings. I imagine that we will remain online unless there's a hue and cry to the contrary. I would love to meet everyone in person. I don't know if it's practical to do that this semester, and difficult also on the university secretary and her office to pull those things together. Though I know for Nancy, it's like nothing is difficult. She's ready to do it. So with that said, we'll see how this mask mandate thing plays out. I have 2 students in my class. So Larissa, thank you for your questions, and also Chris for your questions. I have 2 students in my class that are literally in confinement right now. And they were both in class before. So, I don't know how this would have been reported out to the other students. I have not mentioned to my students oh, by the way, I have 2 people who are absent because they have COVID. Yeah, I don't know. I thought that was a good question, Larissa. I'm not particularly pleased with the answer, but I think that's where we are. I don't have anything else on my for my report. Any questions of me about any of the things that I just talked about, Larissa?
Yes, Finny, thank you. I too have a problem with my camera, so I'm not turning it on. I apologize. I wanted to clarify, am I correct in reflecting back to the students that they need to kind of urge or push their chairs to advocate on their behalf for better information that they can get either from, I don't know who, like, I feel like they want to and deserve information about potential exposures. And yet on the other hand, I could see the reasoning that you may be exploring the same kind of exposures every time you go to a supermarket or any other place. You may be around someone who has COVID, but you just don't know it, and you have to just protect yourself. But I think in a repeated potential exposure environment like a classroom, they deserve more information than, oh, well, ask the Department of Health, I really, and is it enough to tell them to, well, you need to push the chair of your department to get you better information?
Yeah, I don't disagree with that as a suggestion, but I'm not sure what the department chair would actually be able to do. I mean, the information that we have, I don't know. I haven't been pleased with the way information has been shared from the very beginning in this crisis. I don't know what that's going to mean as we go along. So, yeah, and Chris, I see your comment that yeah, the chairs don't have any more pull or authority than anyone else in this, and I hate talking like this because it's just it's not solution oriented. I'm not exactly sure what to do, frankly. And I did get a mask in my mailbox, so I was very happy about that. I know if anybody else is happy about their mask, but I was glad to get it. I see Caroline has put in the comments that APS doesn't contact parents of kids who are exposed if those kids are vaccinated. Yeah,
I can say more about that because I had a student with COVID in my class last year or last semester, and I was wondering why I didn't get contacted too. And I kind of maybe asked enough times to get a response. And I think it was that I think they're thinking along the same lines where since I'm vaccinated, I wasn't even contacted, as being a contact of this within 3 feet of somebody for an hour and a half or whatever who had COVID because I'm vaccinated. And I think that's that's how APS does it, I know. And I'm wondering if that's also what our contact tracers are doing. And that's why some of us aren't finding out that we were actually around somebody for an extended time who did have COVID.
Mm.
I'm not saying I agree with that approach, but I think that might be part of what's happening.
Nancy?
My comment is on a different topic, so if you still have people that wanted to talk about this.
Okay, Jason?
That's Caroline's last comment sort of answered my concerns. Or yeah, I agree with that. I think that's exactly what's going on with the contact tracing. It's related to vaccination rates. Not that I agree with it either, because to my understanding, fatalities and hospitalizations amongst vaccinated also increased quite significantly with the Omicron variant, I think.
Well, we'll have our update later in the meeting. Maybe we can ask some of those questions of the good Dr. Pitcher when he joins us. Nancy?
So I just wanted to mention on the elections, the college and school and branch elections are going on now, but we will have calls for nominations for at-large senators starting on March 1st. So, and then once those are elected, then we'll run the leadership elections.
Okay, thank you.
We
Nancy.
also, just FYI, the Committee on Governments and the AF&T nominations will start on March 1st as well.
Very good. All right. Colleagues, we'll move on to the next item on our agenda, which is our consent agenda. Hopefully everyone's had a chance to see what's on there. Since it's our consent agenda, I'll put the question. Go ahead, Rick, if you don't mind, and if we have a poll for our consent agenda. And these would be our committee appointees.
And the consent forms C.
Is that the? Oh, that's the consent form from Dr. Cheek, this Cheek's office that just came back.
Yeah, we received about 14 of them.
Okay. Are we able to pop those up, Rick, for folk to have a look?
You want us to stop the poll, Vinny, and then?
Yeah, if we could stop that and go ahead and if people haven't had a chance to see what's on the list, I'd like for them to have that before they're voting.
Are you able to pull that up, Rick?
I'm trying to.
Sorry, caught us by surprise on it.
Okay, it should be up now.
Okay, thank you, Rick. All right. Hopefully folk have had a chance to take at least at the bottom that we can't see yet. And is the BA and BS in anthropology the last one on the list?
Yes.
Okay. All right, thank you, Rick. We can go ahead and pull that down. And go ahead and post our poll.
Okay, it was approved 35 for, 1 against, and 4 abstentions.
Okay, colleagues, that consent agenda passes. The next item on our agenda is the new undergraduate certificate for pre-health scholars certificate from HSC. Dr. Burton, are you handy?
But my mic is not on. Hi, I am.
Okay. Please share information about the new undergraduate certificate.
Absolutely. Let me see if I can share my screen here. Are you able to see my PowerPoint at this point?
Yes.
Okay, great. Thank you. So thank you for the time. I'll give a brief overview of the proposed pre-health scholar certificate and then stand for any questions. Most pre-health, not pre-health, most professional health programs, too many words there, are utilizing holistic reviews in their admissions processes. These programs are seeking candidates who are not only good in STEM, but also in humanities. And I think we all can kind of get that, right? Because if we experience illness or injury, we want health professionals who will connect with and hear our stories and who will respect our culture, our meanings, and our experiences. This program was designed to address areas of weaknesses identified by the HSC professional health programs and as issues that they're seeing consistently in their candidates. And beyond strengthening humanities, it also is going to provide opportunities for students to learn more about their desired health careers, as well as having opportunities for interactions with health professionals. The rigor of graduate health programs really leave little bandwidth for students to spend time really contemplating culture or meanings or developing specific skills in communication or critical thinking, or even spend time really deeply in self-reflection about their own culture and experiences and how that could help them as providers. So the hope is by working with students prior to them entering graduate health programs, we'd be able to really help these students think about these things, dig deep and reflect deeply in ways that could be really making a difference for them as individuals, but also helping them be successful in health programs, in the academics part, and then in their professional life. So the goals of the program really are to provide a unique social science foundation for pre-health students. There is no other program like this in the country. Those professional health programs are highly competitive, as I'm sure you guys know. And so the hope is that we help students, provide them an opportunity to strengthen their competitiveness of their applications, but also to provide them some skills and opportunities to improve their potential for success in these programs, and then also in their futures. And then the third goal is to produce a revenue stream for the Health Sciences Rio Rancho campus. The target population for this program are advanced pre-health undergraduates, and these classes would serve as electives to their program, and also post-baccalaureate students, both unsuccessful candidates who are planning to reapply for the programs or degree or career changers. The program and the courses will be transcribed if approved, which allows financial aid opportunities for students, both post-bac and undergrads. So kind of an overview of the structure of these courses. They're really designed to be very interactive, discussion-based, seminar-like, with lots of thought-provoking engagement, activities, application, and field trips that can be very meaningful. There'll be a focus on developing deep cultural humility, and also engaging students to think deeply about their own personal cultural beliefs, developing wellness strategies, recognizing and identifying their own positionalities and their personal learning styles. We'll also be encouraging students strongly to engage in self-reflection, to learn to honor and value their own personal experiences and cultures as valid and as pathways to empathy and connection with their patients in the future. There'll be a lot of skill development focus in critical thinking, problem solving, and in communication, and a range of skills in that area. So there are 5 courses in this program. And briefly, there's the Meaning and Culture in Health and Illness. That course is really going to spend time really reflecting and digging into culture and meanings, and how that along with social, cultural, and psychological factors interplay with health behaviors and outcomes. And then there's Integrating Psychology and Medicine. That course really looks at the importance of integrating psychology into healthcare, as well as having the skill development in patient communication, especially those difficult conversations. And then students will be developing self-care and wellness plans and strategies. That course will be taught by a licensed psychologist. The third course, Critical Thinking, Learning, and Problem Solving for Health Professions, is a very skill-based course, very focused on developing skills, and specifically in those critical thinking, problem solving skills, but also learning about the growth mindset and learning about learning theories, as well as identifying some personal learning styles, and all within a very healthcare framework within that course. The fourth course, communication and action, again, another very skill-based course, really looking at the practical skill of communication and how it relates in health communication among, as with their patients, but really broadly, the engaged listening, looking at narrative medicine, motivational interviewing, but also then their personal interviewing, for they will need to interview for their programs if they get selected for that, and then their writing skills. And then lastly, there's the pre-health observational learning course that has two components. The first one is shadowing. Most professional health programs require shadowing or suggest and encourage shadowing, but this will be guided and directed. So it's really more meaningful and helpful for students. And then there's the community engagement portion. Those will include field trips within Sandoval County to rural and tribal communities to really listen to the stories and from the community, to hear about the assets of those communities and how that helps them with wellness, but also hear about the challenges that they face and obstacles they face in terms of healthcare. So all these courses are designed to be really rigorous 400 level courses to kind of help students begin to transition to really that more graduate level thinking. So that is my overview, and I'm happy to answer any questions.
Any questions for Dr. Burton, colleagues? Hearing none, I would entertain a motion from the floor. This is an action item.
Vinny, I have my hands up.
Go ahead. I'm sorry, Jamal, I didn't see it. Go ahead.
Okay, thank you, Dr. Burton, for that presentation. Couple of things here. I think this is important in terms of looking at the overall issues of workforce development for the nation and the state. How does this support current programs, pipeline programs at HSC right now?
So
can it be achieved through the 5 courses itself?
I'm sorry, the last part of your question?
No, go ahead, answer the first part and I'll come back.
So the pipeline programs that currently exist at HSC are geared more, there's some high school outreach programs, and there are some programs that provide opportunities to strengthen pre-med students and that sort of, those sort of opportunities. This is more broadly to all health professional programs, so not just medical school. So that's a differentiation, as well as this is a much more robust program than any of the existing pipeline programs, because these are actually 3 credit hour courses in the humanities. So most of the pipeline stuff really focuses on the STEM and the preparation for MCAT and that sort of thing, whereas this is really more the humanities side and developing those skills that can help them be successful, and was designed very specifically to address weaknesses identified by the HSC professional programs themselves as I met with them.
So this is more STEAM H.
Yes.
In many ways.
The H side, yeah.
And you'll be working with the BA-MD program as well?
I have met with them and talked with them. I received their input, so we'll be in collaboration, but it's not the same program.
Okay, one last question. Thank you so
Yes.
much so far. With the 5 courses that you're offering for the 18 credit hours, I understand the need for the rigor and what have you. Are you working also with the HSC Office for Diversity and Inclusion, as well as the main campus Office of Diversity and Inclusion, as it looks at the curriculum requirements for meeting such standards as you've offered?
Yes, I have met with Dr. Romero-Leggett, and I actually work with them on some outreach opportunities here at the Rio Rancho campus for high school students. We do a health career academy here. So I definitely work with them and will continue to collaborate with them. Again, this is really focused on that humanities side, but absolutely want to look at supporting all students to have this opportunity.
And these courses will involve a lot of the work that takes place on main campus as well, correct? Or is it just HSC professional staff?
These are all HSC courses. They will be HSC courses, and they'll be at the Rio Rancho campus, but will be scheduled Hopefully the plan is to schedule them on Fridays so that students might have a little more opportunity to be able to participate in those.
Okay. All right. Well, I have some other questions, but I'll get back to you later by email.
Absolutely, be glad to talk with you.
Thank you.
And
Thank you very much, Finney. Dr. Burton, I think you answered the question already, but I'm in the exercise science program. So and a lot of our students target physical therapy, occupational therapy, physician assistants. So this would be open to them as well.
Absolutely. The real goal with this was not to be narrow into like just think medical school. This is all the health professional programs. So the PT, absolutely. I spent quite a bit of time with Dr. Jones, the PT department. We had a lot of conversations in developing these courses. So absolutely.
Okay, thank you.
Absolutely.
One other quick question.
Yes.
Now that you've said that, are you also working with the interprofessional education department at HSC? So that, you know, that the faculty who will be teaching these classes are able to do transdisciplinary work and thinking across these boundaries?
Yes, I've worked really closely through this entire process with Dr. Levi, the Vice Chancellor of Academics for HSC. So, and she has a lot of deep knowledge about the interprofessional program. So we will be in collaboration for sure.
Okay, all right, thank you.
And I've also just for another comment too, is that I've worked closely with Dr. Jim McKinnell of the Pre-Health Professions program there at the University College. And I think he's on the call as well. But so I've worked closely with him as well in this process.
Okay, thank you.
Sue?
Yes, thank you. I'm in the physical therapy department, and this looks fantastic for our students. I was just curious how you are going to set up the observational hours, because that has been particularly challenging, especially during COVID, even before COVID. But to get sufficient hours to kind of make a decision on which way to go in the health professions.
Yeah, thank you for that. Yeah, it is absolutely an ongoing challenge. In fact, even clinical hours is a challenge, right, for existing health students. So I work very closely with Sandoval Regional Medical Center here on our Rio Rancho campus. And of course, they, on the PT side, they have the new Orthopedic Center of Excellence. So that piece and their expanded rehab center there. But I will be continuing to work with both SRMC and UNMH to help make those connections and try and because the shadowing will be more guided and structured as opposed to kind of how we currently do it. We tell undergraduate students, you need to shadow, go do it, figure it out, right? And students are kind of lost to try to, you know, unless they are already privileged to have connections, right? So this will be really working to try to help with that. But it is absolutely, in the COVID world, it's going to be a challenge for sure.
Thank you.
Dr. McKinnell?
Thanks very much. I just joined in today because as Laura mentioned, I've had a chance to sort of talk with her numerous times over the past couple of years as she's worked to develop this program. And it's also been very interesting for me to sit and listen to the comments from especially from representatives on the council here who represent health professions programs, because I think that coming from the health professions, we recognize the significance and the importance of this. I just want to stress that I think that one of the things that we see when we look at our students that are applying to health professions programs, I think that we see a lot of students that are academically very qualified. And what tends to differentiate students that are ultimately successful getting into programs from those that are less successful are these soft skills, this social science awareness and these communication skills. And some of that disadvantage simply comes from cultural background. It comes from where these students are coming from. And I see this certificate as a way to at least to begin to address one of, I know what are many factors that are that exist, that perpetuate the disparities that we continue to see in sort of the students that are successful being admitted into health professions programs. I think this is a real chance for all students to acquire these skills that are going to help them be successful candidates.
Thank you for that. Colleagues, we do have a question on the floor. It's been motioned in the chat to move forward the vote. Do I have a second?
And it's Christine DeLucas. I would second that motion.
Colleagues, it's been motioned and seconded that we take a vote on the certificate. Let me get the right language. Sorry, just a second. That we vote on the new undergraduate certificate, pre-health scholars certificate for the HSC. I'd ask Rick to post the poll, please.
It was approved 41 to 43 with 2 abstentions.
Wonderful. Colleagues, that certificate is approved. Congratulations, Dr. Burton. Thank you for your hard work on this. And it's really exciting to know that we have a really unique, thoughtful program like this being put in place for our students. So thank you very much.
Thank you very much. Have a great day.
Colleagues, the last item on our agenda for today, absent public comment. We don't have anyone signed up for public comment, do we, Rick?
No, we don't.
Okay. The last item will be our COVID update from Dr. David Pitcher. Dr. Pitcher, are you with us?
Yes, I am. Thank you, Dr. Coleman. And good afternoon, everybody. Good to see you all again. Hope you're going to enjoy a little bit of better news than I think I've given previously to this group. So let me get my screen share going here. Are you all able to see this?
Yes.
Thank you. All right. So first, just looking at new daily case numbers. These are tracking from the beginning of the pandemic. And as you can see over on the right-hand side, we've had a significant and quick spike with the Omicron variant that began right around the first of the year, maybe in early to mid-December. And typical with the experience that they saw in South Africa, where this first originated or was identified, there was a very rapid uptick in new cases, followed by a very rapid decline. And that's what we're seeing here in New Mexico. And as of yesterday, our average daily cases are now down to about 500 cases per day. And that's down from a peak of around 7,000 just a couple of weeks ago. So that's really good news. The other good news that goes with that is that even though we saw this very significant spike in cases, the real morbidity and so forth associated with new cases didn't spike nearly as severely. We did see hospitalizations go up, but not to the level we saw in the previous winter surge in late 2020 and early 2021. And we're now seeing those statewide hospitalizations come down. And that's very good news. Our hospitals need a break because they're already full with a lot of patients who had delayed care and are also taking up quite a bit of resources around the state. So it's great that cases are coming down. We're not out of the woods yet by any means, but overall we are on the backside of this current surge in the pandemic. The other thing that we're seeing is that the number of daily deaths is also starting to taper off a little bit, as would be expected. When we look at how vaccination status affects new cases, hospitalizations, and deaths, this graph, it really tells pretty much the complete story. Vaccinations are not fully protective. Most never are. So as you can see, there are a number of cases that have occurred in vaccinated or fully vaccinated and boosted individuals. But the good news is that the rate of hospitalization and the risk of death is actually much lower if you are vaccinated and you have received your booster. The vast majority of new cases, hospitalizations, and deaths are still in the unvaccinated population or not fully vaccinated population. So just another reminder that vaccinations are important. Get your booster if you haven't had one yet. And be confident that with vaccination and booster, you're going to be as protected as you can be from various COVID variants. So as I mentioned, the overall number of new daily cases are coming down statewide, and correspondingly, we're seeing the same drop in our COVID positive census within the UNM health system at UNM Hospital and Sandoval Regional Medical Center. And in fact, we're down from a peak of nearly 140 COVID positive patients in our health system about 2 to 3 weeks ago. We're down 50%, and our total COVID census as of this morning was 59. So that is really good news. We are still exceptionally full though. We're still running over 100% occupancy at UNM Hospital. And we're still having to do things to try and keep our overall census down and protect our health system from overstretching our available resources. So we're still doing work to limit transfers in as best we can. And we're only now slowly reintroducing non-urgent or emergent surgical cases into our patient flow. And by doing these things, it's allowed our overall occupancy to drop from recent record highs. We had a high census, record high census of about 650 about 2 to 3 weeks ago. Now we're down to running a census of 566 within UNM Hospital. And even though that is still over our licensed occupancy, that's a much more manageable number. So we're seeing progress here, but we're not out of the woods by any means. And the other thing we're able to do now that we're seeing this rapid deceleration in cases and hospitalizations is that we can start to demobilize all of the resources and staff reassignments and alternative sites of care that were ramped up and put in place to manage these various surges in COVID patient census. So overall, good news. We're still in a protective mode for the Health Sciences Center, where we're trying to make sure that masking continues to protect our vulnerable patient population, and also to protect our limited healthcare resource. And to protect that resource, it only takes a few key staff being out sick with COVID to really hamper important and critical clinical operations in various areas. So we're still taking a very conservative view on how we're protecting ourselves, and we're not letting our guard down, even though the governor has certainly reduced some mask requirements in indoor spaces. So that's my update, and I am happy to stand for any questions.
Thank you so much, Dr. Pritchard. I really appreciate that detailed report. Jason and then Anne, please.
Yes, thank you. Sorry I can't share my video either. Again, it's the internet issues. So I had a question about slide 4, essentially, whereby we had the numbers of hospitalizations and deaths with people that fully vaccinated or fully vaccinated with booster, etc.
Yes.
And I wondered how that, so this is related to Omicron data, presumably.
Yes.
So I wondered how that compared to Delta surge data, because my understanding is that there's quite an increase in the virus's ability to evade the vaccine. And this is reflective of this type of data, whereby we see 1.7% of people of death associated with that, with people that have been vaccinated and boosted.
Yeah, so it's actually an excellent question. So this data is Omicron related data. And it's really just related to a period of time, as you can see, from 1 February to 14 February. These are the numbers. And during that period of time, Omicron was represented virtually 99.5% of variants that were identified. So it's completely replaced Delta. During the Delta surge, we did see much more protection from the vaccines. And so the new case numbers were roughly about 85 to 90% in unvaccinated individuals. Hospitalizations also about that same number. And the deaths in vaccinated individuals made up less than 5% of the overall total. And if anything, closer to 2 to 3%. So what this really just shows is that indeed the Omicron variant has much more ability to evade the immunity conferred by vaccination with either Pfizer, Moderna, or J&J products.
So this is a bit of a cause for concern to ease up unless we had a more specific vaccine, in my view. I mean, I guess numbers are going down generally, but that's because we did have masks in place and precautions statewide that are still reflected in the Health Science Centre, but now it becomes more of a worry, I suppose. That's the way I see it.
Well, it certainly requires more careful consideration. It's not a simple decision to back off of some of these public health measures based simply on raw daily case numbers alone. There is a lot to consider, including the penetration through vaccination of the various strains that are present in the community, the rate of spread within the community, and so forth. So, overall, I think that we also need to remember that we only know so much, and we don't know how to factor in natural immunity to these numbers. I just have not seen that data anywhere that suggests how that factors into the risk of future COVID or future hospitalization or death. So there's a lot we still don't know.
Okay, thank you.
Anne?
Dr. Pitcher, my question is also regarding the same slide. And I'm curious about, are there any data on the number of deaths or percentage of deaths, regardless of vaccination status, that are based on comorbidities?
Yes, there are, but I can't really quote that data off the top of my head. It's been a while that I've looked at it. But certainly the risk of hospitalization and the risk of death, we know increases. Increases proportionately with a number of significant comorbidities like obesity and hypertension and diabetes, among others. And we also know that the risk is substantially increased beyond the age of 70 or 65 and beyond that. So if you were to look at one of these graphs by different age groups and by different comorbidities, you'd see, you know, widely different kind of perspective.
Okay.
Thank you.
Go ahead, Subu. Thank you, Ann.
Dave, I have a question for you. I took the booster dose in sometime in October or November, and I read CDC reports that the potency or the immunity that those booster doses provide you wanes around 4 months. And the fourth dose or the second booster dose is not ready or probably will be ready for general population sometime in fall of 2022. And I also see or read reports that there is a subvariant of the Omicron, which is the BA2, which is even more potent than the Omicron, probably comparable to the Delta. So given these, and the situation where we let our students and faculty relax the mask mandates, and if our immunity wanes in 4 months after the booster, aren't we exposed or aren't we at the mercy of another variant?
Those are still somewhat unknown. The BA2 variant doesn't seem to be taking off. It is present in many countries around the world, and it's present in the United States, but overall Omicron still seems to be the dominant variant. That being said, it's expected that as COVID moves into more of an endemic phase, we're going to see these seasonal variants start to crop up. You know, much like seasonal flu does. One of the things that we don't yet know about the booster is what is the appropriate interval for doing that. We know that immunity seems to wane somewhat, but we don't yet have great data on that suggest when you get the best benefit from an additional booster. We expect to see that in the next couple of months. We've already seen recommendations starting to come out for a second booster for immunocompromised patients. So I would expect that to be followed in the next couple of months by additional recommendations regarding timing for boosters for other populations and the general population at large.
So Dave, one quick follow-up. So going forward, if immunity wanes in 4 months, what should we do? I mean, aren't we equally exposed with or without the booster?
I don't know how to answer that question. I don't think we really know. I think it's still postulated that indeed immunity wanes with time, even after the booster, but we don't know to what degree and to what degree of risk that creates for the population. We just don't know.
So isn't it a good idea to keep the masks on?
I think keeping masks on that's a complex equation, and it really depends upon the setting that you're talking about, the population you're dealing with, the rate of spread within the community. and, carefully weighing what the consequences of or the downside of not wearing masks, what that might look like. So it's not an easy answer. And I hope I dodged that appropriately, but I am not inclined to suggest that masks need to be considered forever. I think there will be a transition that we will be able to make when community transmission drops below 5 to 7 per 100,000 per day. That's truly a low-level transmission, and the risk is pretty low at that point. And that's when the downside of wearing masks and its impact on communication and learning and teaching, that's where we really have to consider that. And that's my personal opinion.
I accept your personal opinion. It's an informed opinion. I wonder, I think for all of us, we're looking at these trends in the data and actually hoping that, of course, we get to the end of this thing. I mean, as you look at the trends, does it suggest a window when we might be making those kinds of transitions? Are we just going to, it's kind of the diamond water paradox, right? If you know there's, well, anyway, what are your thoughts on
that? Well, I'm an optimist, and I like to think there was a famous French surgeon, Charcot, who said that disease is old and nothing about it is new. It is we who change as we learn what was formerly imperceptible. COVID is another pandemic viral illness, much like the Spanish flu, seasonal influenza. And we know a lot about how those things behave, and they tend to behave like COVID is behaving. You see waves of infectivity. You can occasionally see pandemic-like events like we've had for the last 2 years. But ultimately, the virus will settle into the population. There will be a certain degree of natural or herd immunity that's developed. And you start to see viruses doing what they do, which is to mutate and evolve, but generally stay kept in more of an endemic phase. I believe we're getting close to that. Most major pandemic illnesses of the past have followed that same kind of 2 to 3 year cycle, where you get waves with essentially different strains, but eventually dying out into more of a seasonal phenomenon. And I think we're close. And I think that because, Omicron really hit a lot of people. There were probably even more that were not diagnosed through testing than we're aware of. And I think that's why we're seeing it die out so quickly. It really burned through the population quickly, highly transmissible, but low morbidity. Most people were not significantly affected by it, but now people have developed that immunity. And that's why you're seeing it die out very, very quickly. Now, how that immunity translates into future strains is left to be seen. But what we do know with the flu virus, for example, is that if you're vaccinated for one particular strain of virus 1 year, that doesn't necessarily protect you fully from the strain that may come along next year, but it may have some marginal protection so that you don't get horribly ill from the flu in the future. And I see parallels in what's going on now with COVID.
When you say close, and this will be my last question at least, do you mean close like by the end of the semester close, or close like a year or two from now close?
Oh, no, I just sort of projecting the way this wave is going, I would say by end of semester, we should be in a much different place than we are now. I'm optimistic that we're going to hit what I would consider to be more of an endemic phase by early summer.
Okay.
That's the trajectory we're on.
Just an added thought here, Dr. Pritchard. Thank you for your thoughts on the clinical uncertainties that exist with this within healthcare settings. But as you both know, and as you said, it's a huge calculus out there. And so it's harder to predict what the outcome will be with the new variant when we look at the issues of neglect within community health and population health and all the other factors that could predispose one to these things. So as a precautionary measure, you know, as we talk about indemnity, does the Health Science Center have any plans to sort of move in the direction such as like what's been proposed in California and a couple other states right now in terms of moving some of those resources to dealing with the endemic status so we're not caught unprepared?
Well, the short answer is yes, but we're not really actively talking about that. We're still trying to demobilize during an active surge. So even though the numbers are coming down, our focus is on redirecting resources acutely, but we're not looking longer term than that.
Understandable. As you said before, I think you mentioned that it was something like 560, the census was 566
yes
beds. And so, you know, getting that down to a more manageable level is of quite importance right now as we talk about those who have are experiencing the syndemics, you know, with the multiple conditions and things of that nature. So on the preventive side, we're still, you know, we've got to stop dealing with prevention deficit disorder and get back to basics.
Yeah, no, I agree with you.
Colleagues, any last questions for Dr. Pritchard? Hearing none, our agenda is exhausted. We are adjourned.